connective tissue. What is it? As the name implies, connective tissue serves a connecting function. It supports and binds other tissues in the body. Unlike epithelial tissue, which has cells that are closely packed together, connective tissue typically has cells scattered throughout an extracellular matrix of fibrous proteins and glycoproteins attached to a basement membrane. Types of connective tissue. Loose connective tissue. As the name implies, connective tissue serves a connecting function. It supports and binds other tissues in the body. Unlike epithelial tissue, which has cells that are closely packed together, connective tissue typically has cells scattered throughout an extracellular matrix of fibrous proteins and glycoproteins attached to a basement membrane. There are three types of connective tissue, which is: collagenous fibers are made of collagen and consist of bundles of fibrils that are coils of collagen molecules. Elastic fibers are made of the protein elastin and are stretchable. Particular fibers join connective tissues to other tissues. Another type of connective tissue is dense or fibrous connective tissue, which is found in tendons and ligaments. These structures help attach muscles to bones and link bones together at joints. Dense connective tissue is composed of large amounts of closely packed collagenous fibers. Much of the dermis layer of the skin is composed of dense irregular connective tissue. Pre-specialized connective tissue. Adipose. Adipose tissue is a form of loose connective tissue that stores fat. Adipose lines organs and body cavities to protect organs and insulate the body against heat loss. Adipose tissue also produces endocrine hormones. Cartilage. Cartilage is a form of fibrous connective tissue that is composed of closely packed collagenous fibers in a rubbery gelatinous substance called chondrin. The skeletons of sharks and human embryos are composed of cartilage. Cartilage also provides flexible support for certain structures in adult humans, including the nose, trachea, and ears. Bone. Bone is a type of mineralized connective tissue that contains collagen and calcium phosphate, a mineral crystal. Calcium phosphate gives bone its firmness. Blood. Interestingly enough, blood is considered to be a type of connective tissue. Even though it has a different function in comparison to other connective tissues, it does have an extracellular matrix. The matrix consists of the plasma, while red blood cells, white blood cells, and platelets are suspended in the plasma. Lymph. Lymph is another type of fluid connective tissue. This clear fluid originates from blood plasma that exits blood vessels at capillary beds. A component of the lymphatic system, lymph contains immune system cells that protect the body against pathogens. The connective tissue disease. Any of the diseases that affect human connective tissue. Diseases of the connective tissue can be divided into 1. A group of relatively uncommon genetic disorders that affect the primary structure of connective tissue, and 2. A number of acquired maladies in which the connective tissues are the site of several more or less distinctive immunological and inflammatory reactions. Hereditary, genetic, connective tissue diseases include Marfan's syndrome, homocystinuria, and osteogenesis imperfecta. The acquired diseases include, among many others, rheumatoid arthritis, systemic lupus erythematosus, rheumatic fever, and osteoarthritis. Heredity disorders of connective tissues. Hereditary disorders of connective tissue are a heterogeneous group of generalized single-gene determined disorders that affect one or another of the primary elements of the connective tissues, collagen, elastin, or ground substance glycosaminoglycans. Many cause skeletal and joint abnormalities that may interfere seriously with normal growth and development. These conditions are rare compared with the acquired connective tissue diseases. Osteogenesis imperfecta is a disorder of connective tissue characterized by thin-walled, extremely fracture-prone bones deficient in osteoblasts, forming cells, as well as by malformed teeth, blue sclerae, and progressive deafness. Type I osteogenesis imperfecta is the result of a dominant gene. It develops in childhood and is typified by single fractures from trivial stress. The tendency to fracture lessens at puberty. Type 2 osteogenesis imperfecta, the result of a recessive gene, more severe and less common than type I. The child at birth suffers from countless fractures. Life expectancy is short. Fundamental defect in this disorder appears to involve synthesis of collagen fibers. Hurler syndrome, or leukopolysaccaridosis type I, the most common and most rapidly fatal. Few children afflicted with it reach the age of 10. Abnormalities begin to appear when the infant is a few months old. Cerebral function deteriorates gradually, and various deformities of the extremities and face develop, accentuated by stiffness of the joints. The facial deformities and dwarfed, deformed bodies that occur in Hurler syndrome and in Hunter syndrome, leukopolysaccaridosis type 2, are referred to as gargoyle. Individuals with leukopolysaccaridosis other than Hurler syndrome commonly live to adulthood, but a normal lifespan is unusual. The mode of inheritance is autosomal recessive in all the types except Hunter syndrome, which is sex-linked recessive. Only males show the disease. Acquired diseases of connective tissues. The acquired connective tissue diseases are described in detail in this section, display certain common clinical features, including inflammation of the joints, polyarthralgia and arthritis, serous, fluid exuding, membranes, pleurisy and pericarditis, and small blood vessels, vasculitis, and a high frequency of involvement of various internal organs that are particularly rich in connective tissue, e.g., the lungs. The walls of inflamed blood vessels, portions of which may become necrotic, i.e., may die, are often found to contain characteristic deposits of hyaline, translucent, material called fibrinoid because staining with dyes, e.g., eosin, reveals tinctorial properties similar to fibrin, a fibrous protein that forms the lattice of blood clots. Rheumatoid arthritis is a chronic disease in which inflammation of the peripheral joints occurs. The disease process within the joints begins as an inflammation of the synovium, joint lining tissue. In most cases there is an increase, often considerable, in the amount of synovial, joint, fluid. Other manifestations of the disorder include blood vessel inflammation in the form of tiny areas of necrosis in the fingertips, chronic leg ulcers and lesions in the peripheral nerves, inflammation of the pericardium and of the sclerae, inflammation and nodule formation in the lungs and pleura, tissue covering the lungs, anemia, enlargement of the lymph nodes, and Sjogren, or Sickes syndrome. Sjogren syndrome, or Sickes syndrome, is an autoimmune disorder characterized by dryness of the eyes, keratoconjunctivitis sicca, dryness of the mouth, xerostomia, often coupled with enlargement of the salivary glands, and rheumatoid arthritis. Sometimes the dryness of the eyes and mouth is associated with other connective tissue diseases, such as systemic lupus erythematosus, polyarteritis nodosa, dermatomyositis, or scleroderma, rather than with rheumatoid arthritis. Sjogren syndrome is a disorder that primarily affects postmenopausal women. Treatment is directed toward relief of symptoms. Epithelial tissue. Epithelial tissues line the cavities and surfaces of blood vessels and organs throughout the body. Two types of epithelial tissues that occurs in the body. One covering and lining epithelium, forms the outer layer of the skin, lines open cavities of the digestive and respiratory systems, covers the walls of organs of the closed ventral body cavity. 2. Glandular epithelium, surrounds glands within the body. Epithelial cell classification. Most epithelial tissue is described with two names. The first name describes the number of cell layers present and the second describes the shape of the cells. For example, simple squamous epithelial tissue describes a single layer of cells that are flat and scale-like in shape. Simple epithelia. Simple epithelium consists of a single layer of cells. They are typically where absorption, secretion, and filtration occur. The thinness of the epithelial barrier facilitates these processes. Simple epithelial tissues are generally classified by the shape of their cells. The four major classes of simple epithelium are: 1. Simple squamous. 2. Simple cuboidal. 3. Simple columnar. 4. Pseudostratified. Simple squamous. Simple squamous epithelium cells are flat in shape and arranged in a single layer. This single layer is thin enough to form a membrane that compounds can move through via passive diffusion. This epithelial type is found in the walls of capillaries, linings of the pericardium, and the linings of the alveoli of the lungs. Simple cuboidal. Simple cuboidal epithelium consists of a single layer cells that are as tall as they're wide. The important functions of the simple cuboidal epithelium are secretion and absorption. This epithelial type is found in the small collecting ducts of the kidneys, pancreas, and salivary glands. Simple columnar. Simple columnar epithelium is a single row of tall, closely packed cells, aligned in a row. These cells are found in areas with high secretory function, such as the wall of the stomach, or absorptive areas, as in small intestine. They possess cellular extensions, e.g., microvilli in the small intestine, or the cilia found almost exclusively in the female reproductive tract. Pseudostratified. These are simple columnar epithelial cells whose nuclei appear at different heights, giving the misleading, and pseudo, impression that the epithelium is stratified when the cells are viewed in cross-section. Pseudostratified epithelium can also possess fine hair-like extensions of their apical, luminal, membrane called cilia. In this case, the epithelium is described as ciliated pseudostratified epithelium. Ciliated epithelium is found in the airways, nose, bronchi, but is also found in the uterus and fallopian tubes of females, where the cilia propel the ovum to the uterus. Types of epithelial tissue disease. Eczema. First, let's look at eczema. Eczema, also known as dermatitis, is a disease that causes inflammation and irritation of the skin. In fact, that's what dermatitis means. Derma means skin, and itis means inflammation. This irritation and inflammation of the skin can take on many forms, including swelling, rashes, pustules, and itching. Common causes for eczema include allergies, changes in hormone levels, stress, or genetic predisposition to the disease. While there is no cure for eczema, there are ways to treat it. Ointments and medicated salves can help soothe the symptoms, while prescription medications can help manage the dryness and irritation of the skin. Prevention is a best bet for eczema, including moisturizing the skin and avoiding irritants. Eczema affects the stratified squamous epithelium of the skin, and the underlying blood vessels. Psoriasis. Next, we'll look at psoriasis. Psoriasis is a disease that affects the epithelial cells of the skin, creating a red, scaly rash. Often psoriasis is associated with other diseases, such as heart disease and diabetes. Genetic factors can lead to a predisposition to psoriasis, though the disease is often brought on by environmental triggers. The stratified squamous epithelium cells sense stress hormones, infection, and the presence of certain medications like lithium, a depression drug. Injury to the skin in the form of sunburns or scratches can also trigger psoriasis. When injury causes a patch of red, psoriasis, the phenomenon is known as the Koebner response. Psoriasis affects the stratified squamous epithelium of the skin.